Good morning to one and all, and wishing you a wonderful 2026 ahead. A very warm welcome to all the distinguished guests, colleagues, partners, spouses, friends, and family. It is truly a pleasure and honor to stand before you today as we gather to celebrate a very special milestone, the 7th annual meet and 7-year celebrations of 7SIGMA. I'm Dr. Atra Satish. 7 years of commitment, 7 years of growth, and 7 glorious years of unwavering dedication to health, safety, and excellence. Thank you all for being an integral part of this family and for being a part of this very special celebrations. Over the last 7 years, 7SIGMA has grown not just in size or reach, but also in its impact, touching industries, organizations, and lives through its work, passion, and vision. Today, it's not just about marking time. It is about reliving the journey. Today, it's about recognizing the team, their expertise, discipline, and commitment. Today, it's about collaborations and partnerships. To every team members, past and present, behind the scenes, on the field, and with the clients, this is what 7SIGMA truly stands for. It is about reiterating the gratitude to our clients and partners. You have not just worked with us, you have grown with us. Thank you for believing in us. While today we celebrate the past 7 years, we also look forward to the future. I once again sincerely wish all of you a wonderful 2026. Let us begin today's proceedings by invoking the spirits of knowledge, of wisdom, and of auspicious beginnings. I invite Ms. Jyoti Varya, Ms. Hema Varya, Radha Chechi, Geeta Chechi, and Ms. Sabita, our esteemed women workforce, to light the ceremonial lamp.
കാരുണ്യവാരിധി ചിത്തത്തിൽ നിത്യം വസിച്ചിടണേ. നിത്യനിരാമയ കാരുണ്യവാരിധി ചിത്തത്തിൽ നിത്യം വസിച്ചിടണേ. നിത്യം നമിപ്പിത കൂപ്പുകൈയോടുമായി സത്യസ്വരൂപനെ നിന്നെ എന്നും. നിത്യം നമിപ്പിത കൂപ്പുകൈയോടുമായി സത്യസ്വരൂപനെ നിന്നെ എന്നും. നിത്യനിരാമയ കാരുണ്യവാരിധി ചിത്തത്തിൽ നിത്യം വസിച്ചിടണേ. അന്തിമേഘത്തിലും ചെന്താമരയിലും ചന്തം തുളുമ്പുന്ന ചൈതന്യമേ, നേർവഴി കാട്ടണമെന്നു നീ ഞങ്ങൾക്കു നേരിൽ വെളിച്ചം പകർന്നിടണേ. നിത്യനിരാമയ കാരുണ്യവാരിധി ചിത്തത്തിൽ നിത്യം വസിച്ചിടണേ.
Thank you for that melodious beginning for this day. I now invite Mrs. Jyoti Warrior, Director Finance, to formally welcome the gathering and begin today's proceedings.
A very great morning to one and all, with a dash of Happy New Year, Happy 2026. Myself, Mrs. Jyoti Satish, holds the honor of welcoming you all for the grand 7th annual day of our beloved organization, 7th Care Health Solutions Private Limited. May the benevolent Almighty bless us all on the successful fulfillment of the event. It's my duty to welcome you all for the grand occasion. Let me do the honors first by welcoming the well-dedicated staffs, their families, who are the heart and soul of the 7SIGMA family. I welcome you all and have a great day ahead. Any event will be complete if you make it a day or if you carry the values from the event. I request each one of you to have the spirit of the events. Many of you have assembled here and many are on the way to join us for this event. Let's welcome our beloved CMD, Dr. Satish, the brain and soul behind the concept of 7SIGMA. It is said, you are never too old to set another goal, or dream when you dream. And that is our CMD, Dr. Satish. I welcome you on behalf of the 7SIGMA family, sir. Next, our chief guest of the day is on the way, Dr. B.C. Bhagawan, who will join us soon for the event. He is the Vice Chancellor of Rajiv Gandhi Health University, RGUHS Karnataka, since March 2025, with a long medical career to his credit, and now dedicated towards imparting quality training for various schemes and helping society. We will be blessed if he delivers the guest speech for the day. Amidst us, we are blessed with Dr. E.G. Mohan Kumar, a well-known orthopedic surgeon who has carved a niche for himself in almost all orthopedic procedures and played a pivotal role in reshaping Perindalmanna as a medical hub. We all can be proud to say that our CMD is mentored by the noble soul, Mr. Dr. E.G. Mohan Kumar himself. I, on the behalf of whole of the 7SIGMA family, will be honored to welcome you, and he is on the way to join the occasion. Next, amidst us is Dr. Rajiv Lojanan, ex-Executive Director, Star Health. On my analysis through the web pages, I found that his core skill sets is in insurance management and risk analysis, which requires depth knowledge and analysis. We are indeed blessed to have you on this occasion. We welcome you, sir, for this. Next, the guest of honor, Dr. Mohan Krishnan, Director, Global Health Opinion, has joined us to grace the occasion. His notable contributions include developing hospitals and healthcare organizations from concept to commissioning of the project. It requires meticulous planning and hardcore pursuing skill sets. We welcome you, sir, and we are blessed to have you on this occasion. I am indeed honored to welcome a close associate, friend, well-wisher, and it is rather overwhelming to welcome Mr. Damodar Avanur and with his better half, Mrs. Jaya Avanur. The family as a whole has an entrepreneur mindset. They joined the 7SIGMA cult short before the pandemic period, and since then have dedicated themselves to the 7SIGMA Cares, which aims at building polyclinic concepts in the villages of Kerala. I welcome Mr. Damodar Avanur and Mrs. Jaya Avanur. It is said to have a person as a close friend and create close bonding is Mr. Shaji Kumar, Director, 7SIGMA Health Tech. He is a veteran with 30 plus years of experience in India and abroad in international business management. He and his wife, Mrs. Veena, are very passionate about the 7SIGMA and its cultures. It's a pleasure to have you here, sir. Many are yet to reach the occasion, but I am indebted to welcome Dr. Venkatesh Jayadath, Principal, Acharya Institute of Medical Sciences, Bengaluru. He is on the way. A passionate medical surgeon, a dedicated tutor in shaping future surgeons is what Dr. Venkatesh Jayadath is. He, along with Dr. B.C. Bhagavan, Dr. Narayana Prasad, are very close friends of our CMD. I, on the behalf of 7SIGMA family, welcome you all. Apart from the family and friends, 7SIGMA is blessed with gracious presence of clients. Mr. Sheshadri Subramanian, CEO of SNR Trusts, is on the way, and he is going to grace the occasion with his visionary ideas. A true visionary leader with financial acumen is a blessing to any organization. It is an award from the clients whom we serve and who highlights the need of the hour in the healthcare society. That is what Mr. Seshadri Subramanian is. We are blessed to have Dr. E.G. Mohan Kumar, a well-known orthopedic surgeon, amongst us. We welcome you, sir. Next to join us is Mr. Ravi Selvan, CEO, MK Advisory and Engineering Services, a technical consultant to major TCOs for project viability studies and market surveys. I think he is having a great opinion about 7SIGMA's growth and its trajectory. We welcome you, sir. I have immense pleasure to welcome Mr. Sandeep Jha, Vice President of our G7 Sigma proud partner. He has several flagship projects to his credits, and G7 Sigma plays a major role in handling pan-India phase of G7 Sigma. We are indeed proud to have Mr. Sandeep Jha from G7 Sigma. Our new associates from Coimbatore are on the way, led by C.A. Ravindran, who will be joining the event. We welcome, sirs. They have joined us for the occasion. Yes, we welcome Mr. C.A. Ravindran and team from Coimbatore. We are proud to have you for the occasion, sir. Our organization is strongly supported round the clock by the list of associates who requires special mention. Riosis Group, led by Mr. Subramanian and Raj, Extreme IT for their computer peripherals, Prince Manu Associates for the financial audits, and Usman for all event managements of the day. Once for all, I invite all of you for the function. Once again, I welcome all my family members who support me in my endeavor in 7SIGMA. They are the anchor of this journey. Any event not just focuses on enjoyment, but also on thanking, celebrating, building excitement, and in toto, a positive, celebrating tone for the day. Thank you, welcome once all. Thank you.
Thank you, ma'am. We will now pause for a brief tea break. We request everyone to kindly return in 30 minutes, that is by 11:30, so we may proceed with the remaining sessions. Thank you. For the remainder of today's celebration, as we resume after the tea break, we have a thoughtfully planned program schedule. We will begin with the video that highlights our 7-year journey. Then we have the CMD's address, 7SIGMA accreditation updates. This will be followed by cake cutting, then keynote speech by the chief guest, plenary speech by the guest of honor, addressed by all the distinguished guests, felicitation of our associates, and then we move on to the final segments of the day, which would be awards and recognitions, followed by word of thanks, and then the lunch. We will now present a short video that captures the journey of 7 Sigma over the last 7 years.
Of a man who at 55 decided to rewrite his legacy and create a new venture in healthcare operations.
It all started on a sunny day in Jan when I got a phone call from Mr. Deepak Xavier, the CFO of Star Care Hospital, who is now the CFO at Aster Group of Hospitals, North Kerala, suggesting whether he can get some help in managing his insurance department at his hospital.
And here, the remarkable journey of 7 Sigma starts.
A man in his late 50s could potentially have a lot of things to lose in his life. His credibility after a long professional life, a fat monthly salary, and his earnings for the last 30 years.
He was not alone. His wife, Miss Jyoti Warrior, stepped in not just his life partner, but as the co-architect of his dreams.
When we started the company, myself and Jyoti decided one thing. We are going to have a company which will do only what is ethically correct, morally correct, socially correct, logically correct, and legally correct.
There are 7 values that 7 Sigma abides by that each and every of its staff follows. The first one being patient first approach, which is basically the essence of healthcare services. The second value system is the insistence to be right. It encompasses the things that are legally, morally, socially, ethically, and logically correct. Confidentiality of the patient and their data is the third value system that 7 Sigma believes in. This is of pivotal importance in the present day scenario. 7 Sigma has also identified 165 processes, each with their own turnaround time, and all employees are expected to adhere to this. 7 Sigma believes in asking why not instead of why should I. The sixth value system is envisioning continued improvement and striving to be better always. 7 Sigma value also expands to effective and efficient communication with all stakeholders.
The journey was smooth at start, but the situations suddenly changed.
It was not a roller coaster ride. We suffered enough in the initial phase, the flood, the COVID, and the market.
Any healthcare concept is incomplete without primary health support for the needy. With this vision in mind, 7 Sigma joined hands with Mr. Damodar Avanur in 2019, which provided upliftment of an allying polyclinic which was serving the population of surrounding villages. This gave rise to the first association called 7 Sigma Cares.
But throughout the seasons, we had very nice client hospitals, like namely Caritas Hospital, Mother Care Hospital, etc., who supported us throughout this troubled period for 7 Sigma.
Hence, the 7 Sigma evolved. They shifted from being person driven to process driven. When Ayushman Bharat was launched, they didn't see it as a challenge. They took it as a golden opportunity to serve a huge mass through technology. Hence, it leads to a double engine growth.
It was a turning point meeting Gurmeet Singh, the CEO of leading medical finance company G Money. And he made us to about a big company beyond Kerala market. In the year 2023, there was a great movement happened associating with G Money and forming a company called G Money 7SIGMA.
An entrepreneur who was limited to Kerala market with limited ideas now was empowered to have a vision beyond Kerala. With Mr. Gurmeet's continued support, the company of G Money 7SIGMA put 7SIGMA Healthcare in the Indian market as a pan-India company. Their shared dreams and aspirations gave fuel to the burning fire.
In 2024, by the arrival of Mr. Gaurav, G7 Innovations launched. The company was fully embraced the future of artificial intelligence. They transformed a traditional consultancy to a high-tech powerhouse.
I would like to suggest what is 7SIGMA now. We are in Kottayam, Thodupuzha, Kochi, Thrissur, Palakkad, Calicut and Kannur. Then moved to Tamil Nadu, Coimbatore, Chennai, then moved to Hyderabad. 12 hospitals in Hyderabad and entire care group of hospitals we are servicing for a prestigious government scheme, CGHS scheme. We are in Bangalore, Mumbai, Nagpur, Jaipur, Guwahati, Patna, it is a pan-India company now from Mumbai to Guwahati, from Kottayam to Nagpur. We have covered the South India.
7SIGMA has handled more than 11 lakh bills, settled more than 1,000 crores of amount, growing at a pace of more than 50%.
All these achievements was possible only because wholehearted support from the clients, from the well-wishers and the staffs who work day and night for 7SIGMA. Without them, the achievement would not have been possible. Our prestigious clientele include Care Hospital Group, Vijaya Hospital Chennai, Chidamashwa Hospital Coimbatore, Caritas Hospital at Kottayam and MES Hospital at Perindalmanna, and Baby Male Group of Hospital based at Calicut, Thodupuzha, Kannur and Vatakara. We have got now 50 plus hospitals and 250 plus staff members, which include doctors, medical coders and various professionals involved in health insurance field.
That was indeed a cinematic treat. Thank you for that wonderful presentation. As we celebrate 7 years of 7 Sigma, it is only fitting that we hear from the person whose vision has guided this journey. I now invite our Chairman and Managing Director, Dr. Satish, for his address.
Great morning and happy, challenging and a year ahead, 2026. I'm so happy and to be proud to stand in front of my friends, my mentors, my well-wishers, and the newer associates and partners of my partner companies, and my greatest asset, my staffs. About when we started, Mr. Gurumit suggested, I think it is on 4th anniversary or so, Perinthamanna is going to be a hub. Perinthamanna is going to be known as an RCM hub, and we are marching towards that. And with me today is Mr. Bhagavan, who is already got introduced to you by Jyoti, Rajiv Gandhi University Vice Chancellor, and my good friend who had to cut short of his family commitments and taken much pain to reach here. And to be frank, I'm so overwhelmed to be here, Bhagavan. And with Bhagavan is my friends, both of them, Prasad and Jayadath. We grew together from 84 onwards, and in the Mysore Medical College, in the corridors of Mysore Medical College and the hostel, and we had a wonderful time. And then also we are here to be a part of sharing this success story. And the man who touched my heart is Mr. E.G. Mohan Kumar sir. For any person's life, a man at 25 graduated from Mysore Medical College, and touching the first patient was under him at Al-Shifa Hospital, Perinthalmanna. And it is lucky to have a mentor like him when you start a career, right? And he's teaching that if you do anything with passion, it's a pleasure. I repeat this in my classes when I take from the staff. When you do anything with passion, it is a pleasure. And if you do anything without passion, anything and everything will be a pain. And that work culture, what I say, that's the culture which he has imparted to us during our early this thing has made at least me to be here, and even my brother. That was his teaching. And even though there is a generation gap, I try to instill this feeling, work with a passion, and sky is your limit, right? And you see the revenue cycle management, the concept when we developed after having a problem in Al-Shifa Hospital, where I was handling, sir will be knowing, where I was handling this department, insurance department, from 2006 onwards. It was not an idea all of a sudden developed. Over a period of time, from 2006 onwards, we were thinking that we should have a company supporting the hospitals and managing the patient. And that time itself, I had a vision. We had a vision of touching 10,000 lives per day. As an anesthetist, we can handle only 10, 20, 15 patients a day. But when it comes to an entrepreneur, when there's an entrepreneurship we have, and we are an entrepreneur, we have got a company, we can touch so many lives. The great Ratan Tata told once, the success of a man's life, the success means it is not the wealth he makes, it is not the friendship you have got it, or it is not the likes or followers you get in WhatsApp or social media, it is a number of lives you touch it. And with that, was this thing. Number of lives you influence in your lifetime. How many lives you influence in your lifetime? That is the greatness or the success of this thing. And we are marching towards that. Now, so this thing we knew that the best help to the humanity is to help a patient when he is in trouble. And of course, as a doctor, we have got to limited this thing because we cannot finance any doctor, but we cannot do that. But we can definitely do one thing. We can help the patient by arranging finance for him or arranging the financial considerations for him and helping them to do it. And that is what the basic, why this company was formed. So now the patient, this link, this is the relationship which you make in RCM. The payer is the insurance company or the corporate or anything like that. And the provider is the hospital and of course the patient. Okay, this bridge, we bridge this and this is what is absolutely RCM means. Next please. And now the schemes we support is almost all the schemes where the cashless facility is there, and almost all the schemes we handle right now, and we have spanned over various states of India. Right? Slight repetition will be there. Okay, next. Okay, the company principles. Okay, this is, we are told that the lean principles. A company has to be lean because in all the sense the wastage should be reduced, and with the 6 Sigma principles which was existing at the time of 7 Sigma is a word coined by me. It was there, still it was only 6 Sigma, and only one industry runs with 6 Sigma, that is aviation industry. The 7 Sigma first time it was coined by us. And with this, with a vision, we call it as a 7 Sigma. Next. Okay, these are the principles which we follow during our operations. The 7 Sigma now, you see now it is panic because we want to spread it out. But touching 10,000 lives, okay, it needs so much work and passion. See now, we did 7 Sigma cares with Avanur, Damodar Avanur, and now we wanted to have more clinics and across Kerala, but we had a big problem, that is COVID and flood, which initial level itself troubled us. Then we developed health tech, and then G-Money 7 Sigma, this is the turning point of 7 Sigma. When we associate with Gurmeet, okay, Pottakulathala Tavala ennu parayile, Kentile Tavala, aa Tavalayinnu Dr. Sadish Marala karanam, the only one person was Gurmeet Singh. Then we knew that technology is the one which will take us to the vision of 10,000 lives by 2030. So the technology we associate with another technological company, that is Grey Opus, and formed a subsidiary called G7 Innovations Lab, which is based at Gurgaon. And of course, an entrepreneur will be always seeing the opportunity. Now the new labor laws have come. In the new labor law, there is one code, that is code number 3, which says that in an industry, if a person or an employee gets an occupational disease or some diseases, some injuries due to occupational hazard, it is the employer's responsibility to give a lifelong treatment. Right, a new code, of course, in Kerala it will take some time because of the political this thing, and this is the greatest opportunity now an entrepreneur can visualize. And I foresee it about 2 years back, and Adira, my daughter, has gone for post-graduation in it in the US and completed his master's in occupational safety, and we will be coming out with this health safety solutions shortly. And of course, ultimately in 2009 the CARES found, and Health Tech in 2022, and 2023 G-Money 7 Sigma, and 2024 innovations, and 2025 is this year, and 2026 our newer project starts. And the prestigious hospitals which are in touch with us, that is one Care Hospital Group, and that is 12 hospitals one stretch, we got it, and Sri Ramakrishna Hospital, Apollo Hospital at Adlax, BMH entire hospital group we got it, and we will be getting it to Nerivi and Ganga Hospitals Hyderabad through this BMH, which is funded by KKR Group. Then we are into Vijaya Group of Hospitals Chennai, and we are into mother care. These are the hospitals here, and the Caritas, that was again a turning point, and Universal and Westport Hospital Group. This to tell that we have got now around 48 hospitals now which we are catering. And this is what, next slide. And now, with this thing, this is a company growth factor I had told. This is the growth which we had in the last 7 years. It is almost a sharp line, and it's a year ahead, only first year we had a dip that was in 2020 and 2019, and it was, I don't say it's a gradual growth, it's a sharp growth during this period of time, and in business volume and this thing, and we cater the segments which were given or deserve. I want my, okay, next. So now it is a thing, where do we stand? About 3 years back, we told that we want to be the #1 company in India, and we wanted to be Perunthalmanna to be the hub of RCM services, a concept that developed in 2018, and now where do we stand? Okay, now the competitor I have told, it is not correct to tell the name of the company, but still, for understanding, I tell you, one is Claim Buddy, and second one is, okay, I'll get it. Second one is Claim Therapy is the third one, and CB is Claim Buddy. Claim Buddy. Okay, okay. These are the same major competitors. If you read, you'll know it. And this is the business volume that done in their lifetime is around 300 crores. They have done it. Competitor 1 and competitor 2 has done 600 crores, and competitor 3 has done 800 crores. And where do 7SIGMA stands? Right. We have crossed the 1,000 crores and 1009 crores of claims were settled by 7SIGMA. And I want my colleagues to understand that you are in a company where this much money has been dispersed to the public, patients, through 7SIGMA and its associate. And right, 1009 crores. Right. Okay, now next, this is where we are positioned, and we are the #1 company. And one more slide, where is that we have crossed 11 lakhs bills submitted. Right. Please understand, it's all through your hands, through my staff's hands. 11 lakhs bills were claimed. Right. Right. And we are now in a pan-India company. It has been shown that we are in Hyderabad, Patna, Bombay, this thing, and much more to come, because Sandeep Jai is here. He is leading the show, right, marketing, and he is going in a very fast pace, because servicing cannot go in that speed, right. Okay, next. These are the philosophies of 6SIGMA, which I incorporate to 7SIGMA, because that slide, this thing you have shown that from person-driven, we have moved to process-driven. So now the processes are taking us high, and process will scale us up to any extent where we can. Sky is the limit. Okay, next. Okay, these are the lean quality principles we did. The thing is very simple, very simple. In RCM, we have got 165 processes which needs meticulous attention. In these 165 processes, we have defined, as the previous slide says, we have defined it, and we are measuring it, and we are analyzing it, and we are controlling it. So this is 165 steps of RCM services. We have got a turnaround time, because time is a precious thing. So this is how we work it up. Right. Okay, next. So these are the quality metrics which we'll see, so that we make sure that a client will see all these quality metrics. It is beyond just doing a claim processing. It is beyond just filing a claim file. It is beyond just doing a pre-auth or submission or the settlement tracking. All these metrics which we see, it is at par or more, better than US standards, because we take Healthcare Financial Analyst USA, their ratios as a base, and Indians are far better. Right. Next. So the roadmap ahead, now we have got do something more. We have got a service, software as service, technology tools, because our software outfit will be doing that. And okay, next. And occupational health and safety, which are going in a big way, and we have already got a major construction company and to do that. Next. Claim audit for hospitals. Our new associates from Coimbatore will be taking up this project where we do the claim audit processes, because auditing is always something. Seeing is believing. Right. So we'll be taking it up shortly in 2026. And this is my dream. 7SIGMA procedure codes. Like what we do, like ICD codes, what we do CPT codes, 7SIGMA is going to develop or already developed 7SIGMA codes, and these codes will be universal codes wherein all the schemes will be fit into it. All the schemes will be fit into it, and we will be releasing it by June of this year. Yes, the leadership team, of course, we need to, this thing, no, achievement is always through a team, and team does it. And it is worth mentioning the team with us for this audience, and this is the thing. And of course, this is my team at present with this thing, and Dr. Bhagwan, after his commitment, his present this thing, will be a part of it, or he's a part of it already, and this is my team there, right? And okay, they all represent one company, okay? And round the clock medical team. This is the difference which we made. Medical claim processing is not a clerical job. It is a medical team's work. What Dr. Mohan Kumar writes, it should be comprehended, it should be analyzed, it should be put into paper, and it should be put into a bill, and it should be claimed. And that a clerical staff cannot do that. That is my strong belief. And that is why we have got a 20-member medical team in 7SIGMA. 20-member medical team, which is analyzing it, which is checking it, analyzing it. We don't say correcting it. We will not correct a doctor's report, right? And submitting the claim, so that 7SIGMA's disallowance percentage is only 0.3. When 7SIGMA, through 7SIGMA, if a claim is made out of 100 rupees, 99.7 rupees the hospital gets it. Only 0.3%. It's a dream figure. Industry standard is 6. Industry standard is 6. And the point, this is what our processes which we have imparted the quality in each and every processes. Of course. Okay, because this is what we need. This is what the market needs. This is what the patient needs, and this is what the client needs, right? And this is my team. All these all heads, each department, and some of are picked up and trained by me, and some are already trained and came here. Yes, yes. And this is accreditation what this we have, right? We are as an ISO 9000 and 2015 company. We are got the certificate 2 months back, and our finance department is so strong. Twice we have been awarded the best tax-paying company, right? Continuously 2 years, and this year we don't know, okay, because yet to come. 2 years continuously we got best tax-paying, not the highest tax-paying company, best tax-paying company, without any mistakes, without any penalty, without any this thing, which we are submitting. Sir, nearly, we all should analyze, nearly 1.2 to 1.4 crores of money is flowing into Perinthalmanna market. The money is coming from Guwahati, Patna, Bombay, Pune. That much money is spent here. And each, if we think that even 1 rupee, if it goes to 5 to 6 times of cycles, each time the government gets a tax. So, when we get money from Bombay, Patna, Bombay, everything, that money is coming to Kerala. And that money is coming to Perindal Malappuram, and that money is coming to Perindalmanna, and this much money is rotating here or in rotation here. And even if you think that this 1.4 crores in a month is shifting hands at least 5 to 6 times or 10 to 15 times, that count we can't take it. Each transaction government is getting the money, right? Getting the taxes. This is the power of entrepreneurship for the entrepreneurs, for the society, right? And this is this thing. And of course the journey continues, right? And the vision is 1,000 lives per day. And vision is 10,000 lives per day by 2030. And I'm sure with colleagues like that, with friends like that, with clients like this, with staffs like this, it is very much achievable. And we will move forward. We will move forward and we will move forward. I think it's over. Okay. So, I am very happy and I am very proud to be here on this 7th anniversary day. And God Almighty has given me a very good personal life, good family, very good relatives, and very good friends, very good seniors, and you all. And with you, everything is possible. We will march towards a vision with which most strength, with much more passion, and nothing is impossible. When the initial phase, when the flood damaged us, when the COVID affected us, one great person is A.V. Velumani, Thyrocare chair, and his wordings was an inspiration. When path is painful, we had a painful path. Destination is beautiful, and we are marching towards the destination. Thank you all. Thank you very much.
Sharing that vision and those inspiring and insightful words. Let us now have the cake cutting celebration of the 70th anniversary.
Mohan sir and Bhagwan, please be there.
privileged to have with us a distinguished leader, visionary, expert, and a very close friend of Dr. Satish, Dr. B.C. Bhagwan, the Vice Chancellor of RGUHS, as our chief guest. He is a prominent figure in Indian medical education. He previously served as a principal of Kempegowda Institute of Medical Sciences, recognized for initiatives like Nasha Mukt Bharat program for drug-free campuses, wellness centers for mental health of doctors. He is a visionary with a deep commitment and social responsibility to the medical fraternity. A proud recipient of Transformational Academic Leader Award in 2025, we are indeed privileged to listen from you, sir. Inviting Dr. B.C. Bhagwan to deliver the keynote address.
Good morning, everyone. It's my privilege to be here amongst all of you. This is the third time I'm coming here for the program. Any number of times for my dear friend Dr. Satish. As Vice Chancellor of Rajiv Gandhi University of Health Sciences, which is probably globally the biggest university with 1,500 institutions under us in the healthcare sector in the state of Karnataka, serving the whole country and abroad students. It's a very hectic and busy schedule for me, but my friends like Satish, Dr. Jayadath, Narayan Prasad is there, Dr. Roy Thomas, Dr. Ali, all of us, Shashi, of course, and we are a very close-knit family all the time. So I couldn't miss this opportunity to be here with Dr. Satish in the celebration. I had in my earlier years address, I had mentioned how Dr. Satish and all our friends spent time at Mysore Medical College. First time I realized a Malayali brain could be so good, so good, so efficient, and at the same time, he was very, from the day, as he put it, he was very ethical, very calculative. He actually helped me to figure out what my potentials were at the college. We planned all our career from that college itself, and destiny has brought us here. I always thank all our group friends and especially Dr. Satish today for my position, whatever I have occupied. He is one of the root causes who inspired me from those years. So ever grateful to him. As he rightly put it, when he came up with the idea of RCM, as doctors, we work in the hospital, we treat patients, we attend to every emergency, but hardly we are aware of what's happening around the patient's financial aspect, his family commitments. We only look at his disease aspect. Most of us try to try not to understand a patient as a human being with so many complicated things when he comes with a disease process. We don't treat the patient, we treat the disease. But people like Satish understood the other aspect of patient's agony apart from the disease. And when he came up with this idea long back, 7-8 years back, I was wondering whether this could be implemented, this could be successful, but he had the ideas and he had already started one, and I encouraged him. Then I realized when I went through all his speeches, ideas, I realized what is RCM, how it could help the patients, and where the industry, health industry as a whole, with the doctors, the hospital and the patients and the family, everyone will be benefited. It's a win-win situation for everyone through this noble cause. It turned out to be a good business model too, but as he rightly put it throughout his speech today, and as he always puts it, he doesn't talk about the financial aspects. He only talks about how many claims the company has processed, how many people they have touched already, how many people the problem has been solved. That's the humanity, the humility, and the greatness of an individual with this vision, and also the company, of course. All of you are part of this noble cause apart from the business aspect of it. So I always meet the elite crowd here who are sitting in the front line every time I come, and the ever smiling and happy, dynamic company people, the staff who are growing in number. Of course, a big jump was when he came up with the partnership with G-Money about 2 years back. I was witness to that, and then even at Bangalore, we had long meetings and discussions in improving the quality of business with G-Money and other partners today who have accompanied. My dear friend Shaji is also here from Coimbatore. He is also working for that. So he also spoke about the finishing school which we planned few years back, and it's yet to take shape, probably in the days to come, in the few months or years to come, with wishes of all of you and the blessings of Almighty, as he put it. Probably would be able to do something in the field of medical education also, in terms of training our own healthcare professionals, if not doctors, probably the allied sciences people. Dr. Jaidat was just talking to me. He is a principal in one of the allied sciences colleges, one of the prestigious colleges, Acharya group of institution, that our country is the biggest global hub for healthcare and health education. Probably it will be the biggest healthcare provider in the whole world in the next few years to come. And the team of treating team doesn't have only doctors. Doctor today is one of the important members, but there are other people, nurses, allied science people, diagnostic lab, so many people who are involved in the process of team. And we need to look at not just the doctor, but also giving quality education for the allied sciences and nursing people, which is very, very important. Putting ethical, evidence-based and quality education, and as he rightly put it, the finishing school where they learn about the skills, they learn about the communication, they learn about the art of clinical art of treatment. All these are important aspects which we can look at. Dr. Satish can really come out with some solutions, some SOPs and guidelines for that, and it will be really appreciated because it's going to help the healthcare at the end of the day. We are all here to, I always put it that a country is looked at not just in terms of financial, of course, financial rise, we are 4th or 5th in the world today, but the country's progress always depends on the basic education and the health that we provide, healthcare that we provide to the society. These are the very, very important aspects. Of course, our country, I personally feel the third aspect could be taking care of our farmers. So the education and the healthcare industry, which are the most important aspects, should be touched upon, should be refined, should be helped all the time. In our country, there is big need, and the company like 7SIGMA can definitely help this aspect. And as an individual and as a friend, I always extend my support, cooperation with Dr. Satish all the time. Of course, all our friends group will stand by him, and I wish and I pray Almighty that God gives him all the strength, health, and also the strength to keep the company united and work towards this betterment and better health care for our society, for our community, and for our country. Thank you very much for giving me this opportunity to be here today, and I look forward to come again and again. 2030 he has set a goal that 10,000 process will be done every day, and I wish to see much more than the way it's progressing. I wish him all the best, wish his family, his ever dynamic wife and the daughter Sasi, and all the company employees and all the well-wishers and supporters of Satish, all the best, and we'll meet again next year. Thank you very much, and a very happy new year to you all.
Thank you, sir. And we are indeed grateful that you took the time from your busy schedule for us. We are privileged to have with us a mentor whose teachings and guidance go well beyond the classroom. It has stood the test of time and generations. It is my privilege to invite Dr. E.G. Mohan Kumar, HOD of the Department of Orthopedics, KIMS Al-Shifa Perintalmana. He is an experienced orthopedician with expertise in joint replacement and advanced procedures. We are proud of your achievements and would like to congratulate you for being a torchbearer in the field, sir. Ladies and gentlemen, let us invite the Outlook's Best Doctor South 2025 and Asianet News Special Jury Mention for the Lifetime Achievement of the Doctor awardee, Dr. E.G. Mohan Kumar, for the plenary address.
Dignitaries, my dear friends, Dr. Satish is known to me since early 1990s. He started his career as a RMO with me, and later he became a colleague, an anesthetic colleague to me. And two qualities which I observed in him are humility and integrity. I think these are the two most important qualities for entrepreneur also. Now, most of us or all of us will agree and congratulate him for what he has achieved today. But I don't know how many of us will venture into something like this when he was very comfortable, his life was very comfortable with his profession as an anesthetist. He was a successful anesthetist. Now he is a more successful entrepreneur. So taking risks in life probably has put him where he stands now. And I think entrepreneurship is not a straight line. It's like ECG, there are dips and ups. But fortunately for him, there are no dips. He has straight grown right through. And it's because of his quality. He's simply a genius, in my words. He's a brainy chap. And he has recognized his potential much early in his life and stepped off from his profession as an anesthetist to an entrepreneur. So we all know that he is standing in a very high position now in the in his life. The only advice whenever I talk to him is that take care of your health, because he is least bothered about his health. That is only his only weakness is that only. And I ask his wife and daughter to take care of his health. At least he's not bothered. I wish him all success in his future, and wish that God bless him to achieve touching 10,000 lives by 2030. Thank you, Satish, for this wonderful opportunity to be with you. Thank you.
Now, as a Vice Chancellor, I am standing here, not as a friend now. I appreciate what he or Professor spoke about the health aspect. As Vice Chancellor of Rajiv Gandhi University of Health Sciences, this is very relevant for public. That's why I just wanted to take just 1 minute of your time. As a Vice Chancellor of the biggest university in Karnataka, I have taken up few initiatives, as it was rightly mentioned. We all need to address a very, very important issue which has really bothered the state of Kerala, and now the Karnataka is the target, that is drug addiction. So we all should keep our family, our friends, our siblings, our children drug-free, tobacco-free, and alcohol-free. It shouldn't become an addiction. So far, more than 30,000 students have walked with me in various districts of Karnataka, and we are spreading it to all the districts in the state of Karnataka with our programs, making it drug-free campus, declaring drug-free campus. Every campus, 1,500 institutions, we are making it drug-free in the state of Karnataka. This is an initiative should be taken not by the educators, but every parent. I'm just telling you, every parent, every sibling, every daughter, every son should take up this responsibility. It's number one, because India is being targeted with drugs by so many forces. Number two, India needs about 3 to 4 lakhs organ transplants every year. But there are only 4 lakh people who have pledged their organs so far in the whole country. In the state of Karnataka, it was only 4,000. So our university and I have taken an initiative to go for organ pledge for all our students and teachers. We have 40,000 teachers and about 3 lakh students. So each one of you, as parent again, as daughters, sons, youngsters, I see a lot of youngsters here today, please take up the pledge to donate your organs, and you can make 8 people live through you. If at all, if you land up in a hospital, if at all, if one of us land up in a hospital with brain dead, then we are allowed to give our organs and we can make 8 people survive. It's a very, very big, noble cause. So all of you take up this issue also. And the third important thing is, our university is making yoga, comprehensive yoga with meditation, compulsory for all the students. So it's a way your students can, the brain could be stimulated, they could be focused, and also depression and suicidal tendency is the biggest menace our girl students are facing in the whole country, and this has been supported even by the Cambridge University. So 20 to 30% of our female students are facing depressions today, and the students in general, boys and girls, are facing tensions and pressures. To come out of it, everyone should exercise and also practice yoga and pranayama that could bring you out of this stress. So thank you very much for listening to me.
Thank you, sir. Thank you, Dr. Mohan Kumar, sir, for your plenary address. And thank you, Dr. Bhagwan, for touching very important social issues. And you are definitely inspiring us with your commitment. Some college friendships stay, and some wither off. Dr. Ali Kumble has been very instrumental in the early college years of Dr. Satish and Dr. Shashikant. It was indeed gracious of him to send a very special message for this 7 Sigma's auspicious occasion. Let us hear from him.
Satish, good morning. This is a really great occasion which really I missed it. I supposed to attend today, but because of the unfortunate reason I was not able to attend today. But it is my privilege to send my greetings to you on this auspicious occasion. Dr. Satish is not just a doctor, he is an entrepreneur. From the medical college days, I realized his capabilities. It was really kept in my mind. As a chairman of Indiana Group of Hospitals, 15 years back, I pulled him from the profession of an anesthetist to an entrepreneur field. I realized he can do wonders in medical field. So I appointed him as my CEO in my hospital, Indiana Hospital and Art Institute at Mangalore. He really did a wonderful job, and his journey was continuing. After a few years, he left my hospital and he joined some other hospital, and his journey was continuing. Today he grown all over India with more than 1,000 employees working under him. I hope he can really do many more wonders in this field of healthcare. I wish him all the success in the future endeavors also. Thank you, one and all.
Dr. Roy, another friend and colleague of Dr. Satish, also had a very, very special message for him and 7 Sigma. Let us hear from him as well.
Dear Satish, greetings from Australia. I'm sorry I won't be able to attend, but I didn't want to miss the opportunity to congratulate you on the remarkable journey and success of 7 Sigma Healthcare Solutions. Having known you since our medical school days, it comes as no surprise to see what you have achieved. Even as a student, you stood out as an enterprising thinker, full of ideas, innovative ideas, always analyzing problems and finding practical solutions. That spirit has clearly carried you through into your professional life. Over the years, I have greatly valued our ongoing discussions and exchange of ideas, and it has been inspiring to watch your vision translate into a thriving organization, making a meaningful impact in healthcare. Congratulations on the 7th anniversary of 7SIGMA. My best wishes to you and to the entire 7SIGMA family for continued growth, innovation, and success in the years ahead. Thank you.
Thank you, sir. Dr. Rajiv Lochanan, the ex-executive director of Star Health, is a prominent insurance industry professional with a robust skill set including insurance, new business development, risk management, sales management. He is recognized as a fellow of Insurance Institute of India. I invite you to enlighten us on RCM and health insurance, sir.
Happy birthday, 7SIGMA. When you are celebrating the 7th birthday of 7SIGMA, I congratulate all the boys and girls of 7SIGMA, including the eldest boy, Dr. Satish. Dr. Satish, I know him initially when I come from insurance industry. So I have known him as a director in an insurance marketing or insurance broking company. So that is where I heard about Dr. Satish for the first time. Then I have come to know about 7SIGMA and its operations. Definitely, you know, already he has shown the triad where the patient, the provider, service provider or the hospital, then the payer, the insurance company. The triad is like this, and in between the coordinator is the revenue cycle manager. So that is how he has shown the picture. And there have been discussions during the meeting also today about the patient right. Our Vice Chancellor sir was mentioning about that aspect, that many a time a patient is treated, but his financial aspects are forgotten or missed. And then about the provider, the hospital. Doctors are aware about the hospital, but now it is time to think about the insurance company, the payer also. The ecosystem has changed substantially over the years, and we have come to a level where the patient is not alone anymore. The patient is not going to pay from his pocket. He will be paying, or the payment will come from an insurance company. Now the question, the picture changes. The insurance company has its own medical team to evaluate the condition of the patient based on records alone. They don't see the patient. So the first thing I used to tell our Satish sir is that, sir, the doctors should generate sufficient documentation. They should give a clear picture of what the patient is, how his condition is. Otherwise, the insurance company will miss out. The sir was saying that the denial ratio is very low for him. That's one of the biggest challenge in insurance industry. So the cashless claim approval comes from the company only when the company is satisfied or the medical team of the company is satisfied. So otherwise they'll be going asking questions, and the hospital or the treating doctor will get frustrated. This is a very important area. So revenue cycle management from the old concept, it has changed to a newer area, managing a patient right from admission till discharge. So I would say that the documentation part also will have to be substantially supported. Sir was mentioning that they will not correct the medical notes, whatever has been written by a doctor. But if the situation demands, you may send it back to a doctor for his opinion regarding whether a clearer picture can be projected, maybe using a better value or a better observation. So this is one of the major area. Revenue cycle management is evolving substantially. And sir was telling about going into 10,000 numbers per day, but I have something more to tell you, sir. Before that, after 10 years, you will be, after 10 years, you will be turning around and seeing a handsome man or a handsome girl sitting next to you. Don't be mistaken, it may be a humanoid. It may not be a human being. Right? So that is the pace at which things are changing in India also. So artificial intelligence has come in place. It is already there. Okay. So sir was saying that artificial intelligence will be applied in processing insurance claims. He has the exposure of substantial, close to 1 million claims being handled. So he can develop a system by which a claim processing can be standardized. There is always diverse opinion or diverse interest for the insurance company and the hospital, or the payer and the provider. The provider says, pay me maximum. The payer says, I will pay you the minimum possible. So there is it's a very difficult area to handle. So some standardization will have to happen there. Now recently High Court has come out with some definite guideline on how a rate should be in a hospital. I don't know whether it is scientifically right or wrong, but the court has come to a conclusion. That a hospital should exhibit its rates. How far it is practical, that is also another challenge. But it is there, it's a law now. So that being the situation, now AI application, standardization, everything is possible. So the difference of opinion between the payer and provider can get narrowed down substantially. That will go in the advantage of the patient and his finances. So that is one major area. Then sir was telling about Perindalmanna. I never thought that he will establish such a fantastic company in Perindalmanna. Because when you think of establishing a good company, you think of big towns. Probably I can take a parallel with Vembu, who has gone and started a company in Tenkasi. So similarly, he has taken youngsters and established a beautiful company here. Special congratulations to you, sir, for this great achievement. The insurance industry has generated health insurance business of 1.18 lakh crores. 1.18 lakh crores. Almost a substantial part of it will have to go through the hospitals, through revenue cycle management, yes. So this is expected to grow. The industry projections are 17%. That looks a little high. Maybe something between 12 to 14% growth will happen. That itself is a big growth in our economy. So this huge size definitely calls for a lot of bringing the energies together, or creating a synergy between the payer and the provider. The gap still exists. When a question comes from the payer, the provider is a little irritated. And the other way around, the payer also feels that every time there is some issue happening in the provider level. So this gap should be reduced to the extent possible, and I'm sure that you have a major role as a revenue cycle manager, sir. Now, the insurance industry is evolving, changing fast. There also the AI is getting entry into. Next time the person talking to you over phone as an insurance agent will not be a human being. It will be an AI agent. I represent a company where we are selling health insurance policies of different companies, different insurance companies. So there also we have inducted AI. Some of the calls will be answered by an AI agent, and he will respond more accurately than a real human being. So this change will require AI system to process claims. There is a cost involved in processing insurance claims. So when AI does it in large scale, the cost will come down substantially. So there is a big hope or scope for your tech platform which you have been designing, which I have been talking to him also. And that will reduce a lot of misunderstanding between the payer and the provider, including, see, when a pre-authorization request is sent, the hospital says there is no PED or pre-existing disease. Then at the time of discharge, diabetes, hypertension, something is mentioned. Then it becomes a big difficult thing for the insurance company to reconcile and pay the claim. So such misunderstandings can be easily avoided by bringing all stakeholders together and growing together. Wishing a very, very happy 7th birthday to organization and everyone concerned. Thank you very much. Jai Hind.
Thank you, sir, for enlightening us. With over 4 decades of experience, Dr. Mohanakrishnan P. has played a pivotal role in establishing and managing leading hospitals across the globe. Let us hear from him the scope of RCM in Gulf countries. Over to you, sir.
My dear friend and CMD of 7SIGMA, Dr. Satish, today's chief guest, Dr. Bhagwan, my friend, Dr. Mohan Kumar, dignitaries assembled here today, and the team, the 7SIGMA team, wishing you all a wonderful 2026, and let us make this 7th birthday of 7SIGMA a wonderful event. First of all, I would like to place on record my gratitude for being given an opportunity to be here in front of you, to address you, and thanks to Satish. And I am also happy that he very often mentions that I also have been, in a small way, instrumental in converting his clinical work into an entrepreneurial journey. And as we all see today, he has reached great heights in his entrepreneurial journey, and he is the director of innumerable number of companies now. So I would like to start from the point that the very interesting name that you have given. We had heard of 6 Sigma, and 6 Sigma being applied into every industry, and that has been the goal. But this name 7 Sigma was a really innovative name, and is for the company, and it is reaching the 7th year today. When I was discussing with a hospital owner in a Gulf country, he asked me whether I could help him with the process of RCM. They were finding it very difficult because of many factors. That particular hospital had a 25 staff strength insurance claims department. In spite of that, they were having around 15% rejections. That is too huge for them to stand. And that was affecting the company's profitability very much. So they wanted to revamp the entire system, to outsource the same thing, that the entire process, to a professional company who could bring down the rejection percentage from 15 to 5%. That was his target. I suddenly remembered about Satish because we had not been in contact with I've been with Satish for many few years, but I suddenly remembered his 7 Sigma and his processes and his expertise in insurance claims management earlier years. So 2 months ago, I contacted him. Suddenly, immediately he responded and he invited me to visit his office. We'll meet up and discuss. I just wanted to talk to him and find out whether he will be interested in taking up this assignment in the Middle Eastern country. So 2 months ago, I visited the office of 6 Sigma along with my wife, and we were really surprised to see the big team there. I never expected this office to be so very big, so very well established, and the principles he followed there and the dedication shown by the team leadership and the team members was really, really wonderful. That gave a wonderful real experience to us. So he said he was, and mind you, the hospitality is on top of everything. So you will make everyone visiting him or talking to him comfortable, and 7 Sigma gave all their credentials and then expressed their willingness to take it up. So I am in the process of interacting with that hospital, and soon I will be getting 7 Sigma involved in working with the hospitals of countries other than India. Now, from the Kerala market, thanks to G Money's involvement, 7 Sigma has become a pan-Indian company. And very shortly, ladies and gentlemen, I can promise you, 7 Sigma will be a global company. Thank you very much, Satish, and wishing you all the very best, and also promising you a journey together. Thank you.
Thank you, sir. Next, we have one of the finest surgeons and of Acharya Institute of Allied Health Sciences, Dr. Venkatesh Jayadath, to address the gathering.
Good afternoon, everybody. I didn't expect my friend Dr. Satish expecting me to talk. Anyway, it's a great honor to be here. I just want to share a few anecdotes, Me, Satish and Roy, whom you heard on the screen, we were together in the 1983 batch from Mysore Medical College. We three got together, and he started with 3 clients, that is me, Satish and himself. Okay, he used to take care of our bills in the hotel, and he was the one who used to calculate everything. Then after that, we got our leader with us in 1984, Dr. Bhagwan, who was at that time standing for as a leadership role, to start as a general secretary of our union. So he was our brain behind it. We were all the workers, the labor workers, and he used to take care of this. And later, the 3 clientele went up to around 15-20 clienteles. So after Dr. Bhagwan became the general secretary of our college, we went to the next step where, we had to take care of the mess. mess for the hostel. So it was 300 people. So again, the brain behind it was he. So what he used to tell me, I still remember when I became the prefect, the first thing he told me was, Datta, do anything you want, give me the receipts. I will take care of everything else. Remember Satish, we sat down in my room number 75 and those days also what he did was, the mess bill, should come down between this money. Because it was a government college and we were all from very poor or middle class background. But he always ensured that we gave the best facility and for a cheaper rate. And he helped me in achieving this. And we had a very big name, and my boss or my friend, my philosopher, he was so proud, telling that, my team has done this, my team has done this. So from there, one more thing was we had something called Throbs 88. Again, our first time we had an intermedical cultural festival. That is the first time in South India, maybe a government college was hosting it. And again, I was from the literary secretary, but the financial secretary was again our great Dr. Satish. So these are the few anecdotes I just wanted to share with you. So other than that, he's an excellent friend, excellent friend. So when I used to be working abroad, if I had some issues, I used to be a little insecure, I used to call him. He used to tell, why are you scared? If nothing is working, come back. I am always here. So he was such a great friend. And now when I look at his growth, I wanted to tell this word, but sir has already told, then pan-India now, it's going to be global world. Because just now when we were coming, or last many times whenever we used to speak, I used to always tell him that you'll have to grow beyond India. And that should be your target. So Dr. Satish or Satish, we have some special names also, only I am supposed to call. Because nobody else can call him that. Because he gets very angry, he says it's only for Datta, not for anybody. Abdullah, he's from Coorg. So we were the initial, the core group. And he has not forgotten us. He was behind us. And I was actually telling, boss is very busy, I don't know whether he'll really be able to make out of. Then I called him, his secretary called me up and told, no, we will have to go. So he was in his own, commitments, but sir took care. He traveled all the way from a village in Shimoga in Karnataka. From there he went to Udupi. He's got up today morning at 1:32 a.m. He's come to Mangalore, he's taken the Vande Bharat, and then he's here in front of you. And that is the friendship and commitment. What Satish deserves, what he deserves, this is what he brings in us. Thank you so much for making us a part of this. And I think one thing I just want to make a small note here, that see nowadays, as some of the speakers were telling, this insurance thing is handled basically by the doctors and the team who are guiding them. What I would feel is the best thing would be to start a course where something like a BA, BSc or diploma or something where our youngsters could be taught. See, this will be really helpful for places like, you have made Perindalmanna a hub now. A lot of rotation is going on. And I think you should bring in some SOPs and you should bring in some many things, which will, set the standards for RCM. Because I have worked in Gulf for a long time and I know how difficult it was, and we know how. Because here, the doctors are not affected, but in those places, the doctors are also affected, because if this revenue comes down, the doctor's salary automatically comes down. Or there is no security in jobs. So that I think you can definitely try to solve it. And you can also guide our youngsters, to approach this RCM in a professional way. And coming out with some soaps and all those things. So I really hope you will be able to achieve that target also. Thank you so much once again. All the best on your birthday. This is Sigma 7, and hopefully, as boss said, we'll be here for 2030, and you will have a target of almost 10,000 or that target, whatever you said, more than that. And may God give you the strength to get all of these people along with you. We can make out the people who are here on a Sunday sitting at this time listening to our talk, means that is the affection and that is the care you have been showing towards your own staff. And a huge round of applause to all you guys for making this happen. Thank you so much once again. All the best to your family members, Sasi, my classmate again. Thank you we have met after a long time, after 40 years I think. So thank you for making me a part of this beautiful program. Thank you and all the best, and God bless you all and wish you a happy New Year 2026.
couple of things what that are told. I just forgot to mention one thing. We have been affiliated to National Apprentice Training Program, and we are training 17 graduates to be a good insurance scheme handlers. 17 of them, and the first batch by this March will be completing their course. So this part is taken care of, and we are into it, and now the 17 members are being trained for that.
Thank you, sir. Dr. Narayana Prasad is one of the most highly skilled orthopedicians in Kerala. Hailing from Kannur, he has more than 25 years of experience and 20 years in joint replacement surgeries. I invite you to address the gathering, sir.
Dignitaries and friends. First of all, let me take this opportunity to congratulate Dr. Satish and his team for the achievements shown here. My association with Satish starts in 1984 when I joined for MBBS. He was my immediate senior. And in college days itself, he is closely associated with us, as said by Bhagavan and Jaidat. And he is known for his leadership skills. As Dr. Jaidat mentioned, the mess management, quality food at a very reasonable price. That was his aim. And later, he is known for his problem solving or puzzle cracking abilities that time itself. And his ideas, other than the medical, in the sense, other than the subject, other ideas was really appreciable. Actually, we have conducted a state level cultural festival in 1988. I think it's Throbs 88, under guidance of Dr. Bhagavan. That time Satish was a general convener, right? He was a general convener for the same. And as Dr. Jaidat mentioned, that time he was handling all the medical colleges in Karnataka. And once again, I take this opportunity, once again I'll thank you, Satish, for inviting me here. And once again, congratulate all the Dr. Satish and his team, and best wishes for the future endeavors. Thank you.
Thank you, sir. Next, we have the CFO of one of 7SIGMA's finest clients, SNR Sons Trust, Mr. Sheshadri Subbaraman, to enlighten us on experiences with RCM companies.
Didn't expect to speak actually, so I'm very casually dressed on a Sunday, and I see all dignitaries are fully in formals, and I am in a t-shirt and jeans. I should have probably packed it as well. I left a little late, and then so we have been associated with 7SIGMA for now for 2 years. We will be coming on to 2 years in February, and speaking about the group and the hospital, we are based in Coimbatore, and we are a very traditional organization, more than 60 years old, and very, very conservative in terms of management. I mean, whether you look at any area, they are very careful, they are very prudent, they are very cautious.
in such an organization to bring about any change, be it technology, be it process improvements, even small things to large things, is quite challenging. I mean, to draw reference, I mean, we have around 13 schools and colleges. We have around 20,000 students that study in those institutions. And we did not have a proper payment gateway solution because the management felt that the manual processes were good enough. And you know, after I joined in 2020 is when we moved into a more technology platform. And I've been, the management has trusted, I had to work to get the trust, but after that they have been, you know, being quite willing to cooperate to make changes. And one of the largest changes that we did in the hospital side is obviously, you know, partnering with 7SIGMA was one of the largest changes that we did. Over time, what we have come to realize is the insurance business has just grown substantially. I mean, when I joined, we were at around 20% of our volumes volumes and value was insurance. Right now, it's around 38, 39%. I expect it to grow to more than 60% in the next 3 years. And 7SIGMA and the team have been quite helpful in bringing, you know, one of the former speakers put it quite well. I mean, bring in a professional management of the claims process. I mean, the end-to-end claims process, starting from the time the patient comes into the hospital and ending with the hospital actually getting the payment from the insurance company. We have been, you know, we have grown together, both the hospital and 7SIGMA, and I've seen the growth in 7SIGMA, and Satish has also become quite a close friend in terms of you know, guiding us also in our any personal conundrums that we come in our day-to-day life. The transition was difficult. I mean, anybody who is, you know, looking at it, the transition is the key. And transition is where, you know, the expertise of 7SIGMA and Dr. Satish in particular, you know, came through, and we were able to make it in 45 days. We were able to stabilize and you know, come to a business as usual standpoint. The few things that I, you know, have really, you know, seen in partnering with 7SIGMA is complete transparency. I mean, that is something that, you know, as a C-suite member, you know, we expect those things to happen. And you know, so even when a mistake happens, even when, you know, people make mistakes, I mean, I make mistakes, everybody makes mistakes. You know, in an earlier gathering, I used to say the only way you cannot make a mistake is if you don't do anything. If you do anything, you know, you are prone to make mistakes. That has never, it is always addressed with an aim of, you know, learning and improving rather than, you know, hiding and running away from it, which is quite a positive change that we have seen. So that is one thing. The other thing is, you know, the entire first pass, what we call as first pass, I don't know what it is officially called. First pass is essentially anything that goes without queries. I mean, that itself is, we were at around 50%, that has now come to around 70-75%, which also for us is a huge thing, because typically, you know, as Sir said, the payer and the provider and the patient form a triangle, a co-joint triangle, right? And insurance is pretty much the last thing that happens to the patient before you know, leaving the hospital. And any delay, any challenge that comes there serves the entire stay, and you know, it creates unnecessary misalignment, or I wouldn't say misalignment, I would say probably, you know, distrust in the system, which you know, with a high first pass we have been able to, you know, address that quite a bit. And also denials are also quite low, and pretty much there is hardly any stay back patients, which also used to be a challenge in our prior days. So when we were initially considering 7SIGMA, I was also quite doubtful, not in the sense that this concepts of revenue cycle management, bringing in a firm from Kerala, to manage something in Tamil Nadu. That was I believe, the first large entry into Tamil Nadu. I think they had smaller things, but we were the largest in Tamil Nadu when they came. Doing that, and doing also in an organization that is very traditional, that is quite skeptical of changes. But the energy shown by Dr. Satish, the wider team, and the processes that they have set up, that has all helped in making this journey quite successful. And we look forward for a long association with them. Thank you. Thank you, Dr. Satish. Thank you for inviting me.
Thank you, sir. Next, we have with us Mr. Ravi Selvan, CEO of MK Advisory and Engineering Services, to enlighten us on the challenges of entrepreneurship.
Good afternoon, everybody. My association with the doctor is about 7 years. In this entire field, I am the odd man out because I am not a medical person, I am not an insurance person, I don't know science. After 10th, I didn't study science at all. But even though sir called me, because my association with the doctor is about 7 to 8 years. My interaction with the doctor is only to say Happy New Year, Happy Pongal, Happy Deepavali. Only the three things we used to have for the past 7 years. And regularly we have a regular touch. And even though he called me, Ravi, we have the 7th year annual celebration, you come and join. Only for this purpose I came all the way from Chennai. And he asked me to give a speech about entrepreneurship and growth. I can give three things. One is, don't give up. Next is, your cup of tea is there. I can explain with my past experience, it is not for the front seats, because all our seniors doctors, they came all the things and ups and downs. This for the third rows and fourth rows who are the youngers, because while I was a finance manager in LV Prasad Group, I am getting very good salary. All are free for me. Everything in one packet I'll be having cash. The train, petrol is free, car is free, food is free. One fine morning my wife called me, resign the job. Because the situation of the work atmosphere changed there. So she asked me to put a full stop, come out of it. What to do? Then with one of my friends, I started packing material. That is for the expanded polyethylene foam, which is used for the electronic industry. I am the topper by the time. For the entire hard disk market, we are the number one by the time. Because the single hard disk, double hard disk. One fine morning, Seagate has introduced shell packing. So we are collapsed. Because for shell packing, all the things, there no need of any packing material. So what we thought is, instead of giving one packet, we redesigned into 2-pack and 5-pack. That is gone. It's going on very well because the revenue is coming, but the volume is reduced. While you're using a single pack, we used to have, just like in Badisha in a sweet stop, we'll be having about 100 to 500 pieces regularly. The cartman will come and will take regular basis. After you've come to 2 to 5, the quantity has been reduced. One fine morning, all the laptop has come, the size of the hard disk is reduced, packing materials collapsed for hard disk. So what we thought, we are entered by, our mistake is we are concentrating only one company. We are happy by the time, we are doing well because we are getting money. I am about 80% capacity utilization there. So we are happy. But one fine morning, that company stopped. So what to do? So then we started for various electronic industry like UPS and everything. Thus company is going well. Then we thought of going for diversification, where we done a very, very, very big mistake of entering into a paper cup industry. In paper cup industry, we don't know what is what. We entered because by the time we have funds. Within 1 year we doubled our capacity. At the end of the period, on daily basis we are having 10,000 rupees in each of my pocket. That is cash circulation will be there, daily we will be getting cash. But at the end of the period, everything went on loss. There is mismanagement, there is miscalculation, that there is no coordination from the employee. Because if the employee put like this, 42 paisa is gone. My profit per cup is only 6 rupees, 6 paisa. All the paper cups only on paisa. So if they put out, finished. We came to listen after 2 years. By the time my loss gone to 18 lakhs. So the first instance where no, you need not put up in the packing. Don't give up. Put your efforts. You will be winning. Your cup of tea will be there definitely. Suppose in the case of the paper cup, you should know where to put a full stop. Whether if you know where you are committing mistakes, where you are unable to rectify your mistake. By the time you are doing only on a semi-automation, all the automation companies have started coming. By the time I am the only person to supply to all the people in Paramuda Nilayam, Sarana Bhavan, or chips. All the people I am supplying daily, but there is no, the top range will be in profit. That is, revenue will be more, the sales is more. If you come to the profit, everything is a loss. We came to know after 2 to 3.5 years. By the time we lost is about 18 lakhs in 2004-5. So what is the thing is, no, you should know in your position to where to put your full stop. One is, don't give up. Put your efforts. Definitely your cup of tea will be there. Definitely will be succeed. At the same time, suppose if you are unable to succeed, or you should know where you commit a mistake. Then even if you commit a mistake, if you are able to sustain, proceed further or put a full stop. That is one song in Tamil. Enakkaga nee ezhudal iyarkaiyil nadakkum. Enakkaga unavu nee enna mudiyum. That is, you can cry for me, but you can't take food from me. So you should put your efforts. Unless otherwise you put your efforts, no one can succeed it. So put your efforts, put 100% efforts. That is my things. Thank you, doctor, for calling me all the way from Chennai. Thank you very much again.
Thank you, sir. Next, we have with us Mr. Sandeep Jha, Vice President of G-Money 7SIGMA, to address the gathering.
Good afternoon, all. Thank you very much for this gathering. I'll keep it very short. 3 years back, when we joined hand with 7SIGMA as a G7 company, the basic agenda was how to take this good work from parental manna to pan-India level. This was the basic agenda where we have joined our hands, right? After 2 years of rigorous hard work, meeting to almost around 40 to 50% of the stakeholder of the corporates, along with that bigger hospitals, we have faced many challenges, many problems, but now 2026, we are on a verge where I'll just speak about the numbers. Before 31st March, we'll be signing a contract of more than 100 crore processing per month. Until December 31st, 2026, the contract value will be more than 200 crores per month processing. Being a vice president of this company, I can just assure you about the numbers, since I am a number person, so that's why I can assure you about this thing. And this is just because what we are doing good to the society. Wherever we are performing since last 2 years, those people have recommended us to the bigger corporate. So bigger corporates are calling us now. Whatever presentations we have given in the past, now they are turning up to the numbers. So I would really thank to the team. Entire team is the responsible for the better work, good work, what we are doing. I hope the team will be performing on the same path so that at least we achieve what we are trying for. As sir told, 2030, 10,000 claims. I think 2026, 27, maybe that, what according to me, my analysis, it would be more than 20, not more than 2027. I'm sure about that number. Thank you very much.
Thank you, sir. It is indeed a great privilege to invite Mr. Damodar Avanur, Director of 7SIGMA Cares, our first association, to to share his journey with us.
I'll not share my journey, I'll be as brief as possible. Satish was talking about some of his assets. Your assets of friends. So many lined up here. Where's Dr. Bhagwan? He's left, is he? Okay. He's taken all the trouble to travel from Shimoga, Mangalore, and then take a Vande Bharat and be here. Dr. Mohan Kumar, awfully busy person, sitting here on a Sunday, being with us, and all these fine gentlemen. These are your assets, along with your employees and customers. Last time when I met Satish, when we had a meeting, he was kind of depressed, taking on more business, attrition. And one of the reasons that we analyzed was his drive for perfection that was causing him issues. അതിൽ HR-ന് റോൾ ഉണ്ടെന്ന് എനിക്ക് തോന്നുന്നു കേട്ടോ. And as you said about Sridhar Vembu's Tenkashi, here I am also from Peridalamanna, and what we find is getting good talent. Suppose I was in Thrissur or I was in Ernakulam or Bangalore, the talent available for us will be much more than what we can get in Peridalamanna. അപ്പോൾ ഇതിൽ HR-ന് ട്രെയിനിങ് റോൾ, അപ്സ്കില്ലിങ്. ആ വീഡിയോ കണ്ടപ്പോൾ നിങ്ങൾ കുറേ ആൾക്കാർ മൗസ് ഉപയോഗിക്കുന്നത് കണ്ടു. മൗസ് വലിച്ചെറിയണമെന്നാണ് ഞാൻ പറയാം. You should use keyboard shortcuts. You can use this, increase your speed. These are some skills that could be imparted to your employees. And then, as you said, imparting AI. ഇന്നലെ ഞാൻ പെർപ്ലെക്സിറ്റി ഒരു എക്സൽ ഷീറ്റിന് ഉപയോഗിക്കുന്നു. വി ലുക്കപ്പ് ഒക്കെ ഒബ്സലീറ്റ് ആവും അത് ഉപയോഗിക്കാൻ തുടങ്ങിയാൽ. വി ലുക്കപ്പ്, സം എഫ്, പിവറ്റ് ടേബിൾസ്, ഇതൊന്നും പിന്നെ ആവശ്യമില്ല ഈ AI ഉപയോഗിക്കാൻ തുടങ്ങിയാൽ. So a lot of operations can be done using AI. Perfectionism can be bought. That is for your IT team. And here's a message I've given for your HR team and to the employees. ഇതിൻ്റെ മുമ്പേ ഞാൻ പറഞ്ഞിട്ടുണ്ട്, you are part of a fast growing company. നിങ്ങൾ അതിലൊക്കെ അഭിമാനം കൊണ്ടോളൂ. Yes, be proud of it. പെരിന്തൽമണ്ണ ഇരുന്നിട്ട് you are meeting the needs of customers across the country, and he has predicted across the world ആവാനുള്ള സാധ്യത ഉണ്ട്. ഇതിലൊക്കെ അഭിമാനം കൊണ്ട് ഇതിൽ ഡെഡിക്കേറ്റഡ് ആയിട്ട് വർക്ക് ചെയ്യുക. എന്നും രാവിലെ നമ്മൾ ജോലിക്ക് വരുമ്പോൾ ഒരു പാഷനോട് കൂടി ഇറങ്ങാൻ നോക്കുക. ഇന്നും ജോലിക്ക് പോകണ്ടേന്ന് വിചാരിക്കാണ്ട് അത് ചെയ്യാൻ തുടങ്ങിയാൽ നിങ്ങൾ നിങ്ങളുടെ ജോലി എൻജോയ് ചെയ്യും, കമ്പനി ഗ്രോ ചെയ്യും, നിങ്ങളും ഗ്രോ ചെയ്യും. With these words, Satish, all the best. Your growth graph is fantastic. ഇനി ഷൂട്ട് ചെയ്യട്ടെ മോളിക്ക് എന്ന് പറയുമ്പോൾ. And your effort to pull in your daughter is a good move. King Samsargima, she is not fully convinced, but then I am sure that you will get your way. Thank you very much.
One thing I want to tell you about Avanur, we are running a polyclinic without any formal agreement, without any difference of opinion so far in last 7 years.
Thank you, sir. Now we have Mr. Shaji Kumar, Director of 7SIGMA Health Tech, to address the gathering.
Very good afternoon to all, and it's a privilege and a pleasure to be here on the 7th anniversary of 7SIGMA, and I would like to congratulate Dr. Satish, the entire team, and the honorary dignitaries who are present here. Your guidance, your wishes, all are coming into a very prosperous situation for 7SIGMA, and during the coming years you will see a 7SIGMA health safety also. And this was in our mind for quite some time, and I was fortunate to have a discussion with the government of India 4-5 years back to implement this policy in the labor laws. Fortunately this year, it is going to come into effect from this year, and moreover, one of the developments which is happening across India is data protection law. I'm also in advisory panel to the Government of India, and hopefully that will also help the health industry to prosper, as he always say, ethically correct. These are the things which is going to happen in the future, and we are proud to be a part of that one. And I salute and I thanks Dr. Satish and his team and the entire team. Thank you. Wish you all very happy, prosperous 2026. Jai Hind.
Thank you, sir. We have a wonderful association with the market team from Coimbatore under the leadership of C.A. Ravindran, sir. I now invite Mr. Gururajan from that team to address the gathering. Thank you.
Very good afternoon to distinguished dignitaries and the entire team of 7SIGMA. We are very much delighted and happy and to be proud to be part of this excellent celebration, 7SIGMA 7th anniversary celebration. We recently associated with Dr. Satish Kumar, and he is an excellent human being. First of all, he is an excellent person and is an excellent visionary and true leader. So, and we wish him all the best in the coming years to be this aim, this vision, 10,000 claims to be achieved with all your support in this entire team of 7SIGMA. All the best. Thank you very much.
I now invite our Executive Director, Mrs. Shalini Warrior, to announce our associates and felicitate them.
Hello everyone. Before we move into the awards and recognition ceremony, I would like to honor a few teams and people who have helped in shaping the organization that we are today. These are our associates who have helped in providing the support and infrastructure that drives us. I would like to invite Subran from Rios's team to This is the man behind Edge, as we all know, the main software that drives our operations. I would like to invite Osman from the admin team. I think he has stepped out. I would like to invite Srijit from Extreme IT. Osman from admin team. We are now delighted to begin the most awaited moment of the day, the rewards and recognition ceremony. Ladies and gentlemen, it is with great pride and joy that we announce the recipients of this year's Best Performer Awards. These individuals have gone above and beyond in their respective departments, setting inspiring examples of dedication, professionalism, and excellence. Let us celebrate their achievements together. the Best Performer Award in Medicep department. We are pleased to announce Ms. Sumaya as the Best Performer in Medicep. Ms. Sumaya has worked tirelessly for the department, demonstrating remarkable commitment in a short span of time. As always, willing to go beyond office hours, she faces challenges with confidence and ensures smooth workflow within the team. Her dedication makes her truly deserving of this recognition. Best Performer in TPA, Mr. Kamal Nath. Joining 7SIGMA on 4th December 2022, Mr. Kamal Nath has consistently shown strong work ethic and a calm, composed approach. His steady performance and leadership qualities have earned him the position of team leader, where he continues to inspire his colleagues. In Dr. Satish's own words, he was the hidden gem in TPA. Best Performer in CGHS, Ms. Ardra. Beginning her journey as a claim executive in the TPA department, Ms. Ardra transitioned into CGHS and quickly mastered its operations. Today, she confidently manages all sections independently, showcasing her expertise and consistent excellence. Best Performer in CASP, Ms. Gopika. With 4 years of dedicated service, Ms. Gopika has become the backbone of the CASP section. Her deep knowledge and hands-on experience enables her to manage the entire section independently. Thank you, Rafiq. Thank you, Abnu, sir. This year, we are introducing an award for a set of select employees who have diligently handled the crisis situations that we faced. Moving between various front office and back office teams, these are a set of employees who have been our go-to to handle crisis, be it at front office or back office. We truly appreciate their hard work and dedication and would like to honor them with this recognition. Please welcome Prasita, Jitin and Nandakumar onto the stage. We are deeply thankful for your contributions. The next award is for the Best Associate of 7 Sigma. We are honored to present this award to Mr. Sandeep Jha, the Senior Vice President at G-Money. He has played a pivotal role in maintaining a healthy relationship with client hospitals across the G-Money 7 Sigma domain. The next award is a moment of pride for the entire 7 Sigma family and for me personally. I would like to call upon the entire Caritas front office team to receive the Best Effort Team Award. The team has embraced changes in processes, changes in technology with such a grace and elegance that we did not think was previously possible. Caritas front office team, please come over. A few names that I would like to specifically take are that of Mr. Sibi, Ms. Shruti, Mr. Anand and Mr. Arun. Through the whirlwind of changes, they have taken utmost care to stick to the tags and follow instructions, leading to this tremendous achievement. Thank you, team. Please come over. The award for the best back office team this year goes to a team that has acted as a backbone for the entire organization, identifying the misses, making sure we correct them, liaising with the clients. There is no area that they have not touched. They are truly the agency that makes sure that the entire organization adheres to the 7 values that we stand by. Under the able guidance of Jyoti ma'am, this year's Best BO Team Award goes to the most deserving team, the accounts team. Accounts team, please come over. Sanju and team. Ladies and gentlemen, it is now my distinct honor to present the most prestigious recognition of the day, the Star Employee of 7 Sigma. I would like to invite Bhagavan sir and Mohan Kumar sir on the dais to give away this award. This accolade is reserved for the individual whose contributions have not only elevated their department but have also strengthened the very foundation of our organization. Please join me in welcoming Mr. Sanju from Accounts team to the dais to receive this distinguished award. In just 2 years with 7 Sigma, Sanju has transformed the accounts team from a small, independently functioning unit into a dynamic force that drives and supports every other department. His meticulous attention to detail, his relentless pursuit of accuracy, and his unwavering commitment to correctness in every report has set him apart as a true leader. Tonight, we celebrate his dedication, his vision, and his impact. Congratulations to a star of the organization. We extend our heartfelt wishes for his continued success and growth with 7 Sigma as he continues to inspire excellence and lead by example. Thank you, Sanju.
Thank you all. It's such a great honor for me to have received this award. At a very short span, I was able to grasp all the concepts of the work which is being carried on. I really believe that it is always a team work for me. To get this award, it's always the support of my team, support of the other stakeholders, support of the inter-department team leaders. It's all because of this that I've received this award. And I really thanks the whole 7 Sigma team for the support. Thank you very much.
Apologies, I missed out one name, the best performer in the IT team. I would like to call upon Nidin. He has been my go-to person for all random activities like getting some data or pivoting or generating reports. So I thank you. Nidin, please come over. Thank you, and over to you, Atira.
Thank you to Ms. Shalini. Next, we have Dr. Shashikumar, our director, to deliver the vote of thanks.
Respected Chairman, Chairperson, Honorable Chief Guest Dr. Bhagavan, the Guest of Honor Professor Dr. Mohan Kumar, distinguished guests, and dignitaries of and on the dais. As we come to the end of this program, it's my proud privilege to propose the vote of thanks. First and foremost, I express my sincere gratitude to our Honorable Chief Guest Dr. Bhagavan. As you heard, he had traveled a lot to be here with us. Thank you very much, sir. And our guest of honor, Professor Dr. Mohan Kumar, my vocabulary fails me to describe our association with him. Thank you very much, sir, being the guiding spirit in our personal and professional life and being here with us. I extend my heartfelt thanks to our respected Chairman and Managing Director, Dr. Satish, for the constant support, guidance, and encouragement that made this program so wonderful and successful. 7 Sigma had experienced a dynamic journey for about 3 years, during which we had the privilege of associating with our best associate, that is G-Money, under the leadership of Mr. Gurmeet Singh. His support played a vital role in strengthening our claims operations, perfectly complemented by effective medical financing solutions. Unfortunately, owing to unavoidable circumstances, Mr. Gurmeet could not be present here today, but he is competently represented by my dear Sandeep, Vice President G-Money. Thank you, Sandeep, for being here with us. I would also like to thank the other dignitaries Mr. Rajiv Lochanan, our RCM consultant. And I would like to mention, sir, you had mentioned about bringing in AI into claim processing. I am glad to inform that Dr. Satish is already into this, and I understand that he has completed almost 50% of the logic behind it. And Dr. P. Mohanakrishan, our RCM associate for Middle East. Thank you, sir, for being with us. And we had 4 chunks, sorry, 5. Chunk in Malayalam means close to the heart. From our medical college days. Dr. Bhagwan and Datta, you are just the same, the exuberant Datta I saw 40 years back. Thank you very much. And Prasad always has been our friend altogether. And we had Dr. Roy and Dr. Ali, who could not be here due to last minute hitches, but they have sent their blessings to us. Thank you, Prasad and Datta, for being with us. And I would like to thank Mr. Damodar Avenur, Dr. Shaji Kumar, who has been throughout in the journey together. And special mention towards our associates, Mr. C.A. Ravindran, Mr. Gururajan, Mr. Senthil Kumar, Mr. Subramanian, IT, Mr. Usman and Srijit for being here and constantly supporting us. I would also like to thank Mr. Vivek for providing us with a wonderful presentation. A special word of thanks to all members of 7SIGMA family for their empathetic attitudes towards the patients and their needs that contributed to the maximum to the glory and success of the company. Thank you all for being here with us. My sincere appreciation also goes to all the organizers and coordinators for their dedication, hard work, and meticulous planning behind the success of this event. And a great word of thanks to all the staffs, family members, and ex-employees for their involvement and presence here. Lastly, I thank everyone who contributed directly or indirectly for making this program a grand success. Once again, thank you all. Have a great day ahead. Sorry, I forgot to mention Mr. Sheshadri, who is our CFO of one of our prestigious client, SNR Trust, and we are extremely grateful to you, sir, for being here with the family.
Thank you, sir. Now we proceed for the most awaited part of the day, and that is the lunch. Happy lunching, everyone. Thank you. Thank you for being a part of the celebration.